Welcome to The Explainer. Today, we're going to unravel a couple of real-life medical mysteries to show you what's really happening to your brain when you go under general anesthesia. Okay, let's just dive right in. Most of us think of anesthesia as just flipping a switch. You're on, then you're off. But the reality? It is so much more complicated. This isn't sleep. It's a carefully controlled, reversible coma. And sometimes, the brain just doesn't follow the script. All right, let's open our first case file. It all starts during what should have been a completely routine surgery. The patient is out cold, the team is focused, but a little message from the other side of consciousness is about to create a real medical puzzle.
So, picture this. The operating room is calm. The monitors are all showing stable vital signs. The surgical team is doing their thing. Basically, by every medical measurement they have, this patient is deeply and safely anesthetized. Everything is going according to plan.
Now the anesthesiologist is keeping a close eye on the patient's brain activity. They use this device that gives a number called the Bispectral Index, or BIS for short. The reading is 45. Now, just for some context, if you're wide awake, you're at about 100. The target for surgery is between 40 and 60, so 45, that's right in the sweet spot. Perfect. But then, after the procedure is all done, the patient reports something just deeply unsettling. They had this crystal clear, vivid memory of hearing a conversation from inside the OR. Now, they don't remember any pain, they don't remember the surgery itself, just the words. And they found those words very distressing.
And that right there is the million-dollar question for our first case. With the brain activity monitor showing everything is perfect, how is a memory like this even possible? What went wrong?
Okay, so let's solve this thing. The answer is actually pretty fascinating, and it reveals a key fact about how our brains are wired. This wasn't a faulty machine. It was about the unique resilience of one of our most stubborn senses.
So what happened here actually has a name. It's called accidental awareness. And in this specific instance, it was a type that only involves sound. The reason for this really comes down to the brain's own internal hierarchy.
Okay, so here's the really crucial part. The science behind it. Anesthetic drugs are fantastic at shutting down the high-level parts of our brain. The bits responsible for consciousness, for forming complex memories. But it turns out our auditory pathways, the wiring for hearing, they're much tougher. They are just way more resistant to being switched off.
So what does that actually mean? It means even with the perfect number on that monitor, a BIS score of 45, it is still possible for sound to get processed on a very basic level. The brain can't really make sense of it, it can't connect it to pain or what you're seeing, but the raw data of that conversation, it can still sneak through and leave a mark. And look, they did their due diligence. They ruled out other stuff. Could the monitor have been wrong? Well, that doesn't explain why only sound was remembered. What about PTSD? That can affect how you interpret a memory later, but it doesn't explain how it got formed in the first place under deep anesthesia. No, the most direct explanation is the incredible resilience of our hearing.
So that first case is all about how one part of the brain can kind of fight back against anesthesia. But our second case, well, this one explores what happens when the whole brain has trouble coming back online. It's about that prolonged, confusing fog that can be especially common in older patients.
So for this case, our patient is 70 years old. And here's a really key detail. They already have some mild cognitive impairment. They're going in for a super common and successful surgery, a total knee replacement. And the operation itself? It goes perfectly, no issues at all.
But then, in the recovery room, and for the next 2 days, something's wrong. The patient just isn't themselves. They're confused, they're disoriented, and their awareness seems to just come and go. This is a textbook case of something called post-operative delirium.
And this is our second big mystery. I mean, think about it. The anesthetic gases have been breathed out, the IV drugs are out of their system. So why is the brain's software still glitching? This isn't just about feeling a little groggy. It's a fundamental breakdown in how the brain is processing everything. So what's going on?
To figure this one out, we've got to go deeper, right into the brain's chemical communication system. We need to see how these drugs can sometimes leave behind a disruptive echo long after they're gone. All right, the absolute key player here is a neurotransmitter called GABA. The easiest way to think about it, if your brain's neurons are like cars flying down a highway, GABA is the main brake pedal. It's the brain's primary off signal, telling all those cars to slow down and stop. So here's the chain of events. Anesthetics basically come in and boost the power of GABA.
They essentially slam on the brain's brakes, hard. And while that's what you need for surgery, it totally disrupts the normal chatter between different brain regions. Now, for most brains, rebooting is no problem. But for a more vulnerable brain, one that's a bit older or already has some cognitive issues, that restart can get really messy.
Basically, the brain's communication grid gets all tangled up and it can get stuck that way. And it's not the drug that's still there, it's the mess the drug left behind. For these vulnerable brains, unscrambling that network and getting back to normal just takes a lot longer.
Okay, so we've cracked our 2 cases. What's the big takeaway here? What does this all tell us about that mysterious state we call general anesthesia?
Well, the biggest thing is this. That whole idea of the brain being a simple on-off switch, it's just wrong. It's much more like being the conductor of a huge orchestra. Anesthesia's job is to selectively quiet down different sections at different times. And every now and then, an instrument or two, like our hearing, just refuses to go completely silent.
And really, these 2 stories boil down to a few super important points. First, how your brain responds to these drugs is incredibly individual. Second, different parts of your brain have different levels of sensitivity. And third, understanding all of this is what helps doctors prevent these kinds of complications, which ultimately make surgery safer for every single one of us.
And all of this research, it really points us toward a pretty incredible future, doesn't it? A future where anesthesia isn't this one-size-fits-all hammer, but is instead precisely tailored to your unique brain, your wiring, and your vulnerabilities. A future where we don't just flip the switch off, but we carefully fine-tune the entire network for a perfect, safe, and seamless journey back to consciousness.